6 ladies, Lady A, Lady B, Lady C, Lady D, Lady E and Lady F visited the hospital. All 6 of them were less than 5 months pregnant. Each had a different problem from the other. Lady A was having minimal vaginal bleeding, and no pain at all. The only reason that had brought her to the hospital is bleeding during pregnancy. Lady B, she was having lower abdominal pain. She was bleeding irregularly and it was very dark. She also complained of realized that her belly bump had reduced in size. Lady C, she had minimal bleeding and there was irregular lower abdominal pains. Lady D, she complained of bleeding lumps and clots. She was having lower abdominal pain and she could tell her belly bump had reduced in size. Lady E was having bleeding that resemble menses. She says she has no pains and that she noticed a decrease in the daily bump. Lady F complains of passing, foul-smelling discharge. She had fever and when the lower abdominal was palpated it was tender. She was breathing really fast and she had 120 heartbeat per minute. All the 6 ladies were sent for an ultrasound. Guess what? They were all having an abortion. Abortion doesn't necessarily means getting rid of the pregnancy because you don't want it. There are 2 types of abortion based on cause. It can be induced or spontaneous. In their cases it was spontaneous since it had no human being interference. The 6 of them were having abortion, but different type of abortion. Lady A, who had minimal bleeding, with no pain, was having a type called threatened abortion. Since on examination of the ultrasound, her cervix was okay and had closed. All the product of conception was in the uterus, and the uterine size was okay. She was advised on bed rest, and was sedated and was given antibiotic to prevent infection. Lady B, who had irregular dark bleeding, and some pain, was having missed abortion. Since on examination of her ultrasound her cervix was closed. All product of conception was still in the uterus but the fetus has died. Management was done and evacuation was done to prevent infection of the uterus. Lady C, who was having irregular pains and bleeding, was having inevitable abortion. Since her cervix was dilated but all the product of conception was still in the uterus. Lady D, who was having lower abdominal pains and was bleeding clots and lumps, was having incomplete abortion. Since on her ultrasound it showed the cervix was open. But not all products of the conception was in the uterus. Some had retained and some had been expelled. Lady E, who had no lower abdominal pains, but was having bleeding that resembled menses, was having complete abortion since on her ultrasound, it showed her cervix was closed but all the product of conception had all been expelled out. Lady F, who was having a foul-smelling discharge, was having a septic abortion which is due to infection. All her signs pointed signs of infection.